Hi, welcome to the second feedback session. So in this feedback session we will discuss 4 different assignments that you uploaded this week about module 2. And in this module you were asked to specify your research question and to make a first start with your patient journey. So to rank the different actors that you already identified last week in your journey map, and also to identify the different phases that a patient goes through. So I have 2 examples I would like to discuss, and Armand also will discuss 2 different examples. I have 2 examples about patients with osteoarthritis. And this first one had a very nice research question, and I will read it to you. What makes the patient feel heard and cared for until complete recovery? 2 things about this research question. First of all, what makes the patients? Specify your patient group. So name what kind of patients you focus on. And the other one I was doubting about, until complete recovery, and maybe not all patients will have complete recovery. So you could also say, well, until the complete care process. But what I like a lot is that it's about feel heard and feel cared for. So it's really about the experience of patients themselves. So that's a good topic for a patient journey. And of course your research question will guide how you will design your journey. The other research question, also for the same patient group: how do patients with thumb-based osteoarthritis experience surgical treatment? And there you see, so it's focused on surgical treatment, can be a choice, but then also your patient journey should only focus maybe on the hospitalization and the surgical treatment period. So you could also make it a bit broader, maybe talk about the care process. So the 2 first journeys that were developed, this is the first one. So you see the actors here ranked from most important till less contact. The surgeon is an important actor but doesn't have that much contact maybe with the patient. The phases, and here you see the different touch points. One thing about touch points, so the touch point describes the interaction between the actor and the patient. Most of these touch points were described objective, but here one touch point you see it's described as the surgeon with the patient in making the diagnosis. So the surgeon listens carefully to the patients, taking notes and on physical and emotional state, explains clearly the problem and solution. So there with clearly and carefully you already make some assumptions about how the surgeon should interact with the patient, but you do not know yet. So our suggestion here is to keep it objective, the touch points. And one other thing I want to mention, this is the other example of the first draft of the patient journey. So again, here you see the phases. Here one actor is mentioned, government and health insurance, and also a phase payment could be important, but again, then it should also be part of your research question if it is important in your journey. And one thing to add, so here the phases are mentioned, but there's no timeline. So try to also give a timeline underneath and to give an indication of the time that is spent in the different phases.
Yes. So I had also 2 examples selected to discuss with you today. Marijke already mentioned, but also in this example, please also indicate the duration, the average duration. So it doesn't have to be very precisely, but give an intimation. Is it days? Is it months? Is it weeks? In order to have a better understanding of the context. And also in this example, the vertical axis includes the actors, but we will suggest to only include the human actors in the vertical axis. And here, for example, guidelines is mentioned as one of an actor, but it's a non-human actor, and try to integrate the non-human actors in the touch points that you have described. So in that way, you can think of touch points where the non-human actors are used as a part of the interaction. Another example was this one, and for this one I think it's important to keep using the template that is provided, because then you already have the vertical and the horizontal axis, and the horizontal axis consists of the different phases of the journey, and on the vertical axis you have, as said now, the human actors. So please use the template. Another thing about this, and we like it very much that a title was given to this journey, but the disadvantage can be that this journey looks like more a journey of one individual patient. So you can make it more generic, the journey. What is also mentioned here, there are different type of products and services that are put there, like the icons, and you can use the products and the services used during a certain phase to describe the touch points, so integrate them more in the description of the touch points. And maybe one other thing, and this is example already did, but this is of course for next week of the journey, to add the emotion line of the patients into it.
Yeah, one thing to stress, so Armand already mentioned it about the title, like your research question guides your journey and what you will include in your journey. Giving a good title to your journey also helps. And make it a bit more generic, but it gives a certain focus on what you will include or exclude from your journey. So think about good title to your journey as well.
Yeah, so good luck, and see you next week.
See you next week.